How will new prostate screening breakthroughs change testing? Imagine a future where catching prostate cancer early becomes even easier and more accurate than ever before. That future is quickly becoming a reality thanks to exciting new breakthroughs in screening technology. These advancements are set to transform how doctors detect, understand, and treat prostate cancer, making care more personalized and effective. One of the most promising developments is the emergence of blood-based liquid biopsy tests. These tests analyze circulating tumor DNA in the blood, which can reveal genetic mutations linked to prostate cancer. For example, a test called ARCORT Detect can identify mutations in the androgen receptor gene, which is important because it helps predict how the cancer might respond to hormone therapy. This means doctors can better determine a patient's risk level and decide on the best treatment options earlier, such as choosing between chemotherapy or radioligand therapy. These blood tests are less invasive than traditional biopsies and can be repeated over time to monitor how the disease is progressing or responding to treatment. Another major change is happening in imaging technology. The use of prostate-specific membrane antigen positron emission tomography, or PSMA-PET scans, is improving how we see and stage prostate cancer. New formulations of PSMA-PET agents are being developed to make these scans more accessible and easier to use in larger batches. These scans can detect cancer spread more accurately than older imaging methods, allowing doctors to identify metastases earlier and plan treatments more precisely. This means patients can get targeted therapies sooner, which can improve their chances of better outcomes. Artificial intelligence is also playing a key role. AI tools are being integrated into screening and treatment planning to help predict which patients with high-risk prostate cancer will benefit most from specific therapies. For example, AI can analyze complex data to identify patients who are likely to respond well to drugs like abiraterone, an androgen receptor pathway inhibitor. This personalized approach helps avoid unnecessary treatments and side effects, making care more tailored to each individual's unique disease profile. Targeted radioligand therapies are another breakthrough. Treatments like 177-Lu PSMA-617 are now approved to be used earlier in the treatment process for metastatic prostate cancer. This allows patients to receive targeted radioactive treatment sooner, which can help control the disease better and improve quality of life. All these advances mean that prostate cancer testing is moving beyond just measuring prostate-specific antigen levels. It now includes genetic, molecular, and imaging biomarkers that give a fuller picture of the disease. This helps doctors detect aggressive cancers earlier, stratify patients by risk more accurately, and choose the most effective treatments. Blood tests can also be used to monitor how well treatments are working without needing invasive procedures. These innovations align with current medical guidelines that emphasize personalized care based on comprehensive diagnostic information. While PSA testing remains a useful tool, combining it with these new technologies offers a more complete approach. This can reduce overdiagnosis and overtreatment, which are concerns with traditional screening, and focus on interventions that truly benefit each patient based on their disease biology. Of course, it's important to remember that these new tools are meant to complement, not replace, clinical judgment and shared decision-making with healthcare professionals. Patients should always discuss their screening options and treatment plans with their doctors to ensure they receive the most appropriate and personalized care. As research continues, these breakthroughs promise a future where prostate cancer detection and management are more precise, less invasive, and ultimately more effective for everyone.